realized, or what was the process when you realized that you have a health concern and you went for a checkup or something like that?
Well, it's funny because I've been asking my doctor for several years to do either a PSA or a digital exam, and he kept telling me not to worry about it. And I went on a trip with my family down to Florida, and I had some pretty strong pain in my lower abdomen. So when I was down there, I went to see a urologist for the first time in my life. And as he went to leave the room, he was stepping through the door, and he turned over his shoulder and he said, "Oh, by the way, what are your PSAs running?" And I said, "Well, I've never had a PSA exam." And he said, "Oh, we're going to do that right now." And I mean, they were taking blood probably in 45 seconds. And we got the results about a week later, maybe even less. And he called me and he said, "Well, we're going to have to watch this because it's elevated." So we did the biopsy. It was a Manhattan pattern, 12 needles, not a real fun thing to do. When I got in his office, he closed the door and he sat down and he looked really serious, and I thought, oh, this isn't good. And he said, "Well, 11 of your needles are completely clear, but your 12th needle, 20% of the sample showed cancer cells." And my first reaction was, well, 20% of one needle, you know, I figured my body would fight that off on its own. So I said, well, that's pretty good. He said, "No, it's not good. You have cancer." And I said, "Yeah, but isn't that, you know, such a small amount? My body's going to, you know, do away with it on its own, natural defenses, immune system?" He said, "No." So he told me he thought I should have a prostatectomy and have it taken out. But he wanted me to go online and look at all the possible treatment options that there were, and make a decision based on what I found out in my research. Even though, as far as he was concerned, surgery was what he called the gold standard. Looked at a lot of different options and really went back to see him. The only option I really got excited about, as far as my interests were, was when I went to see the radiologist in the cancer centers of the Carolinas, and she said she could cure me through external beam radiation without any surgery, without any seeds, and only kill the cancer cells and not kill my healthy cells. And I thought that was great, so I got very excited about that. And I went back to see my urologist, and he said, "Oh, Vern, you must have understood. That's not possible."
Oh my gosh.
And I said, well, I questioned her very closely about it, and he said, no, you misunderstood. I said, well, you know, I've been speaking English for quite a while, and I'm pretty sure, you know, I've been pretty good at asking questions, and she said that it would not harm my healthy cells, but will kill the cancer. It was probably IMRT, I'm guessing. But he said, no, you're mistaken. He says, we really just need to do the surgery. So I said, okay, fine. It got to be about 10 days before the surgery, and I really was not comfortable with the idea. I said, well, Doc, I understand what you're saying, but I really feel like this is not the protocol for me. I just don't want to do. I don't want to do what I don't think is right for me. There's got to be somebody in the U.S. doing what they're doing in Germany. It can't be that Germany is the only place in the world that does this. So I started a web search, and within, I think, the top 2 or 3 on my web searches came up VCI, Valley Cancer Institute. So I feel very good about the very gentle nature. I really appreciate the fact that they didn't put try to put chemotherapy in me. They didn't try to fill me full of drugs. They didn't try to kill off my healthy cells. That basically the treatment is about attacking the cancer through heat and radiation, and using those 2 approaches to destroy the cancer without destroying the rest of the prostate. I drove home by myself.
Oh, you drove?
Yeah, I drove 2,700 miles cross country in 6 days, stopping to see family members and friends, and I did that to just kind of gently get my way back here. I think I caught it really, really small. I think the key to almost any cancer is you don't wait for treatment. Now, I did wait for a while because I was diagnosed at the end of 2007, and I just got done with my treatment in the middle of 2009, so it wasn't like a big rush thing. But I think it was probably a good thing. A couple of things really worked out well. One is we got it when it was still small. 2, we used a very gentle protocol, which didn't disturb my whole body and destroy my immune system like many treatments do. Well, I just sent the patient to VCI about 2 hours ago.
Oh.
So, yeah, I'm encouraging people to check it out. I think it's definitely a treatment that needs to be looked at, and I really think the cutting and the burning and the poisoning is probably not the best thing to do to your body. I'm not a doctor, but I'm not comfortable with the cutting and the burning and the poisoning. It just doesn't seem to make sense to me. Your body's already struggling with something, and then to attack it further and burden it further with chemicals and all these harsh treatments. I just want to express my gratitude to the people at BCI. There were individuals there that really went out of their way to help me, and people that really went beyond just the job and really saw their positions there as a life-saving position. Of course, the doctors, Wolfstein and I, we got along great. He's got a great sense of humor. We always enjoyed each other. So there was a lot of positive times when you're going through treatment, you're alone, you're kind of isolated, and just the people being kind of your friend and trying to encourage you and help you along. That was really good. It was really good.